The Ascension Parish Mental Health Board is now comes to order, and we have Mr. Butler missing, and at this time we're going to turn it over to the people who did our needs assessment, which is Robert Rose. Thank you, lady.
Thank you so much, Madam Chair, and thank you, board members. In July of 2007, the Ascension Parish Counseling and Substance Abuse Center Board commissioned Robert Rose Consulting to conduct a community-wide mental health needs assessment. Tonight we're here to present those results, but first want to say a special thanks to the board members. All of you, Miss Zenobia Batiste from coming out and sweating with us during the heat waves of the summer, to Miss Renda Hotnet sitting through 4 masses on a Sunday. Well, you might need that, Renda, but anyway, we do appreciate that. Miss Italia going to beauty shops for us, Mr. Bryan, everyone responding, going above and beyond to get us the information, get us to the right people. I also want to say a special thank you to Dr. Susan Mittendorf. When we needed information, she sent it readily. When we needed answers to questions, she was there to provide the information. We also could not have done this without many, many people in your community helping us. And I think if you look at this slide, you're going to be pretty impressed. Every single one of these physicians, these community leaders, teachers, school board, parents, had long conversations with us, served on focus groups, helped us with the survey distribution. I also want to say a special thank you to Mayor Leroy Sullivan of Donaldsonville. Leroy and Mr. B.J. Francis made this a priority for their city and went above and beyond to help us during this project. The mission of the project was to survey the general population of citizens about the perceived mental health needs of Ascension Parish and to evaluate the public attitudes about current programs. The purpose of the needs assessment is to make the board and its director aware of those current needs and the population being served by mental health funds. You also ask us to identify programs that can serve as potential models for the future for the parish, as well as identify some funding opportunities as you move forward. All of that information is contained in our report along with the presentation. Tonight you're going to be given a whole lot of data. We have 3 data pieces we're going to review with you. The first one is the community survey, followed by the focus group data, as well as interviews with providers and stakeholders in the community. We're going to finish up tonight with our recommendation and some models of evidence-based practices that you might think about as you move forward. 491 surveys were collected. The survey margin of error is 4.41. For those of you like me that is not a statistical wizard, that just means that it's a really good, valid, reliable survey. General survey items were developed to, let me go back with that, to ascertain perceptions about needed mental health and other services, how people known to respondents cope with mental health issues, the awarenesses of services offered by the Ascension Parish Counseling and Substance Abuse Center, the preferred location for those services, and opinions about whether respondents would send their child to Ascension Parish Counseling and Substance Abuse, and if not, a question asking why. As with most surveys, our survey had more females responding. 76% were females compared to 24% of males. The age range of our respondents was 18 to 91, capturing a nice breadth of the age of the population. The average age was 45. We had 325 respondents from the east bank of the river and 141 respondents from the west bank. The racial breakdown of survey respondents was 47% black, 52% white, and 1% Hispanic. The top 5 services needed for children and adolescents as identified by your population are 78.9% of the people checked off alcohol and drug abuse for children and adolescents, followed by behavioral problems at 72%. Teenage pregnancy came in at 71.2%, followed by aggressive and violent behavior and anger management. The top services needed for adults. Similar to the data presented in the previous slide, services for adults perceived as needed by most respondents was again alcohol and drug abuse, followed by depression, domestic violence, parenting, and anger management. When asked how people they know deal with problems, respondents answered overwhelmingly 74% talk to a friend or family member. 70% say they pray, followed by 55% who talk to clergy. Talking to a therapist or a doctor received 52%, and a very small percentage, 10.7%, of people call hotlines. When asked if they are aware of services offered by the Ascension Parish Counseling and Substance Abuse Center, only 20% of respondents answered yes. 80% of respondents were not aware of the center and the services it provided. When asked where they would prefer to access services if they plan to use them, 69% said Gonzales, 31% said Donaldsonville. This is not surprising given that 69% come from the east bank of the river. So people want to go where they live. When informed that services are based on insurance, Medicaid, or your ability to pay, an astounding 90.80% of people did say they would use or would be willing to use the Ascension Parish Counseling and Substance Abuse Services. Reason respondents are not willing to use the services of the center. And let me point something out to you. We only had 33 people, so this is not a percentage. This is actually 33 people who responded that they would not be willing. And then here are the breakdown of those answers. 5 people said they would have transportation issues, no way of getting there. 7 people said they would have child care problems, followed by 13 people saying they don't know where the center is located. 8 people said they know others who have not been helped by the center, followed by 13 can't afford counseling or substance abuse treatment. 5 people don't believe counseling or substance abuse treatment helps, and 5 need other kinds of help first. And then 8 people just checked other and didn't give us anything specific. The final question asked respondents to name other types of services that should be offered to residents of Ascension Parish. And your parish residents had a lot of ideas. And what we were able to do is kind of lump them into themes and some headings. So the first one are the types of services identified as needed activities for children in this parish. And those were things like the Girls and Boys Club, the YMCA, summer programs. The next heading, alcohol and drug abuse problems, they recommended things like detox centers, rehabs, group homes, more treatment centers, more support for families and people with alcohol or other drug problems, and someone recommended decreasing the number of bars in the parish. Under counseling, people recommended marital, anger management, gender confusion. I was confused. I didn't inquire about that. And relationship counseling. They also recommended developing new places for people, like children to play in parks, have a dog park, have a community youth, maybe activity centers. Family and intimate violent prevention and services, some of the things recommended there are maybe a free batterer intervention program, followed by programs for battered women, dating violence services, child, elder, and emotional abuse prevention, and services for rape survivors. Under financial help, they recommended financial planning, money management. A lot of people said they needed help purchasing medications, as well as generic financial help for indigent residents. Other types of services identified were those things that we categorize as dealing with the religious or spiritual community, things like pastoral counseling and Christian horse therapy, Christian Big Brother program, a Christian babysitter program, and services for youth through the church. Those items that fell under job training, adult education, were meetings for family members of those with mental illness, meetings for those directly affected, grief counseling, and unspecified mental health services. Under parenting, a lot of people mention parenting classes, child care, and unspecified help for single parents. Specific programs, not things like issues, but specific programs for children and adolescents that they identified were boot camps, teen mentors, bully prevention programs, things like resisting peer pressure and self-image enhancement, addiction prevention, general counseling. More Head Start programs was mentioned, as well as programs that deal with ADD, ADHD, crisis intervention for children without long waits, and school violence prevention. Now, those programs identified as being potential programs for the elderly were maybe helping to deal with Alzheimer's, maybe people understanding more about Medicaid and getting more Medicaid for the parish, and some general help. It was not specified. Those public service, what we consider public service type recommendations, or like to see more recycling programs, more sidewalks, more hospitals, schools, and jails, transportation, and a better public school system. Services for people with disability. Some ideas were, why not develop a year-round program for people with mental challenges, drop-off for children with disabilities, to give caregivers a break, and programs to the American Sign Language, like offering classes in the community and developing social activities for people with disabilities. And as well as tutoring, was mentioned a couple of times. An additional request from the board was to analyze results based on regions of the parish, specifically Donaldsonville. This board recognizes that a need exists, but without data, it has been difficult to plan for services. So here's a breakdown by region. Again, we had 141 people from the West Bank, for i.e. Donaldsonville, and the East Bank we had 325 people. The top 5 services needed for children by the region, interestingly, the top 5 remains the same by region. It didn't change, but there are some differences, some slight variations in what was needed by region. For instance, the West Bank has a higher need for teenage pregnancy services and aggressive violent behavior services. The East Bank saw a higher need for alcohol and drug abuse. So there are some slight variations there. The top 5 services needed for adults by the region, again, the top 5 stays the same. But there are some shifts, some slight variations. For instance, the West Bank, on the part of adults, thinks they need more alcohol and drug abuse and domestic violence services. The East Bank identified depression and parenting services as needed more. However, there are greater variations in how people handle problems by region. People in Donaldsonville, let me back up a little minute. If you look at the top item, talk to friend or family member, split down 75% on both regions say that's the thing that they like to do. However, when you look at pray, that's when you start seeing some differences. The people on the West Bank tend to pray and talk to ministers, religious people, more than the East Bank. The East Bank, however, tends to talk to therapists, doctors, or mental health workers more. So there is some variations in how people handle problems, and then you can assume some variation in how people access services. The data is very consistent with research that indicates that minorities that are without access to services, and when there is access, there are issues related to trust and re-stigmatization. If you are already a member of a disenfranchised group, African American, poor, physically challenged, then to seek help through a therapist or a mental health worker might add more stigma. This is also true for Caucasians living in very rural areas. Often they speak to religious members first, such as pastors, sometimes other professionals in their more intimate community. Our summary of our first piece of data are these. The overall survey respondents indicated that alcohol and drug abuse was the leading issue in need of services for both children and adolescents, as well as adults living in Ascension Parish. These findings are fairly consistent across parish regions, as well as across age groups, with a few exceptions. While there are similarities in identified problems, there are differences in how people handle those problems. Again, the West Bank tends to pray or turn to a religious person for help or call a hotline. The East Bank tends to seek help more readily from a medical or mental health professional. A large majority of the survey respondents are not aware what services are offered through the Ascension Parish Counseling and Substance Abuse Center. Most survey respondents would prefer services to be offered in the parish region in which they live. Most respondents would be willing to take their child to the center for services. The number of people not willing to take their child to the Ascension Parish Counseling and Substance Abuse Center is so small, and the data suggests that the residents on the West Bank may experience more barriers to accessing care than residents of the East Bank. I caution you when you look at that data that specifies how many people are not willing to access services, that you get, again, remember that those are not percentages, those are actual numbers. So if you're thinking about percentages, you're looking at between 2 and 7% of 491 people. So remember that. That's a good thing to keep in mind. The belief that counseling does not work may be more common among residents of the West Bank. Our next piece of data are our focus group. The focus groups were conducted in Donaldsonville and Prairieville. The total number of participants in both focus groups was 15. 5 in the Donaldsonville group and 10 in the Prairieville group. Of the 15 participants, 11 were Caucasian and 4 were African American. 5 participants were male and 10 were female. The average range was from 36 to 69. Participants in each group were told that residents of Ascension Parish had recently participated in a survey about mental health services, and the questions posed to the focus group members directly built on the results of our survey. To reduce bias and potential conflict, the board members and the survey team were excluded from the focus groups. The focus groups were confidential and were led by a trained facilitator. Question number 1. When you think about mental health needs in this community or parish, what are the 3 most important issues related to the needs of the children? Overwhelmingly, people said these 2 comments. The availability and timeliness of services are an issue, and the quality of evaluation and mental health problems is poor. Other comments included parents are not aware of mental health problems. It is challenging to get parents to understand mental illness, especially in children. There is a stigma of mental illness, and there are access issues with care and medication. And there is a lack of counseling for problems. Question number 2. What are the 3 most important issues related to the mental health needs of adults? Again, 2 major themes, the availability and timeliness of services and the quality of evaluation and mental health problems is poor. Some of the other comments by focus group members, individual comments, are that parents are not aware of mental health problems. It is challenging to get parents to understand mental illness, especially in their children. There is a stigma, and again, access issues. If you were to add services, given these top issues, how can you make residents aware of existing services? They had really good ideas. Spreading information through the schools, on billboards, yellow stickers on newspapers, and through primary care physician referrals. They also identified campaigns to alleviate stigma. Pamphlets or written materials may be placed in physicians' offices and Walmart. Information may be disseminated through the Red Cross outreach workers and outreach through churches. If we were to add services, how would we inform residents about these new services? What are the most important things to do to get the information out in the community? They came up with ideas like mail-outs, public service announcements on local radio stations, and the 211 system. Churches and members of the clergy could be helpful, as well as billboard ads that use celebrities to destigmatize mental illness, educate the referral sources, and support groups and organizations like NAMI, the National Association of the Mentally Ill. What are the best ways to offer new services to adults in this community? For example, do we use public agencies or private agencies? Do we offer multiple services in one location? And they said definitely public agencies, because most of the residents do not have funds. One place where people can go for help would be good. So they recommended kind of like a one-stop resource center came up. Offer a community-wide education, parenting classes, maybe in a central location. Thank you so much. One psychiatrist in Baton Rouge takes Medicaid, and there is one private practitioner in Ascension Parish. Similar to the last question, what are the best ways to offer new services to children in the community? Social workers that come to school 5 days a week at one school, that's currently happening, and they really like that, and they think that's a really good program. Across the board, people said the school would be a good location to offer services. Services between the private team for PL 504 testing are not accepted in public schools, and the issues around that were bureaucracy and public policy issues. A mental health specialist in the school would be great, as opposed to the school counselors, who are overwhelmed with other duties at the school. School-based education about mental illness is needed to teach children about mental illness, and there are issues related to gangs and gang fights that need to be addressed. Question number 7. What are the current barriers to service in the parish for adults? And what are the barriers for children? Well, for adults, they mentioned cost for services, medication, treating mental illness, again, the stigma, the embarrassment of seeking care, transportation, and lack of insurance. For children, it's lack of communication between the private health care providers and the public school system. The structure of bureaucracy hinders progress for mental health services. There's a lack of knowledge about mental illness in children and a lack of knowledge about behavioral problems in children. Question number 8. How might residents of the parish and members of the community work together to remove these barriers to services? And they had some really good ideas. Their first idea was dialogue. People need to start talking and communicating with each other. People coming together to talk and realize the issues and come up with the solutions. Participation by the Mental Health Board would be essential. One person mentioned with the recent Hurricane Katrina and Rita events and the trauma, the parish really came together to create a team of outreach workers. And why not look at that model and duplicate this to address mental health in the parish? Communication with individuals with political clout who can make things happen. Equitable treatment for both sides of the river, 5 days a week. Electing the right people. Enhancing the sense of community in the parish, developing mentoring programs for young people, discussing multi-service organizations that provide an array of prevention and intervention services, and they gave us some examples, and again, involvement with groups like NAMI, the National Alliance for the Mentally Ill. Question number 9. What are the resources for mental health services for adults? And what are those current resources for mental health for children? We wanted to capture if those members of the focus group knew what was available in the community, and this is what they came up with. For adults, they mentioned the capital area human services. Other adults in the workplace and in the community who act as laypersons that are providing mental health services, in their opinion. The COPE Center at the lake was something else mentioned, as well as primary health care physicians, internists. They also mentioned the Jefferson Oaks Behavioral Program, which is in Baton Rouge. For children, they mentioned the Iberville Rehab in White Castle, followed by mental health workers at some of the schools and physicians in the community. What are the most important steps to take now to develop these services or program? And what members of the community need to be involved in the planning? They identified development of a community group that can plan a new design for services and assist in organizing service development. Members of the community that need to be present for planning included parish officials, the parish president, Ascension Hospital and Crisis Intervention Center, people with resources, including people who can design a plan, stakeholders such as physicians, parents, and family members with individuals who are mentally ill, not just deep pockets, someone who is sensitive to the issues, law enforcement, the DA's office, and the state of Louisiana. Our last question to the group was, if you were given 1 minute to talk to the governor or to Oprah, Winfrey, what would you say? What would be your tagline? And they said, this is what we need. We need counseling services. We need education about mental illness. We need an educational campaign. There is a need for more services. One person mentioned that there needs to be a lobbyist for the mental health services. We need more help for our family. We need immediate and on-time services. And one person's quote was, behind every juvenile in the criminal justice system lies a mental illness. Unique focus group responses from Donaldsonville. Again, we separated out the data for you to have a good idea of what people are saying on both sides of the river. From Donaldsonville, they feel there's a population shift to the East Bank, and that leaves a larger number of socioeconomically disadvantaged residents on the West Bank, which leads to a concentrated poverty and all of the related socioeconomic ills such as gangs, teen pregnancies, and low academic achievement. They encourage the Ascension Parish Counseling and Substance Abuse Center to develop services that are more culturally sensitive. A traditional one-size-fits-all model creates disengagement in the mental health system. There are issues with transportation. There are issues with geographical separation from the rest of the parish and lack of a public transportation system. The 2-day-a-week schedule for mental health services by the center is inadequate. They encouraged us to engage the clergy in mental health care in the parish and to provide more community-based care. They believe the parish and the state are treating them unequally. Lack of equity is related to race, population size, and poverty. And the overall climate of that focus group was one of feelings of frustration, powerlessness, and despair. The unique focus group responses from Prairieville. The issues are there's a disconnect between available services and resources. The services are fragmented, leading to problems with access. They also mention transportation issues, and they mention tension between the public and the private sector. There must be dialogue among agencies, and they said that is critical in establishing a system of care for both our adults and our children. They express frustration about mentally ill people who get in trouble with the criminal justice system as a result of inadequate services in the parish. There are concerns about youth. Some school-based services are available, sometimes 5 days a week in some schools. They mention positive relationships with the Capital Area Human Service District, and they question themselves about organizing and planning a way to increase those services. So there was some ownership that the people in the room could maybe move this idea forward. 3 participants spoke about the resources in the community that we're maybe not tapping into: a grant writer, financial resources, and organizational resources. The overall climate of that focus group was one of frustration, resourcefulness, but hope. Our third piece of data that we're presenting tonight, we interviewed providers and stakeholders. That was something that you recommended to us that we really took to heart, and we felt that was important. Do other providers know what is happening in the parish? There were 29 programs, services, agencies, organizations identified on the Ascension Parish community website. 13 programs could not be reached. A staff member, typically the executive director, a physician, or a nurse, was interviewed from the remaining 16 programs. They were asked about the following: what were their perceptions of the general community health needs, or needs that might exist within specific areas of the community, and what services are provided and to whom, and their perceptions concerning the services provided by the Ascension Parish Counseling and Substance Abuse Center. There are 4 consistent themes, consistent comments, and they are: the mental health services lack publicity and advertising to inform the general public of when, where, and how services could be assessed. Transportation and financial barriers are especially acute in the western part of the parish and may require special attention to make those services accessible. Outreach services are needed from community-based programs such as schools and churches, particularly on the west bank of the parish. Those who were aware of the Ascension Parish Counseling and Substance Abuse Services and had received feedback from clients referred to the center reported that the admission process was lengthy. There were issues with it being adjacent to the state agency. and they said that the center was not suited to handle crisis situations. It's not what the vision is, but what the vision does. And this is our transition slide into your recommendations. I'm going to tell you right up front that we have tried to be exhaustive with these recommendations, but there are other wonderful things that you could do, and you could move in a different direction than what we're recommending. But this is based on the data, and our entire team. I have Tara Haney and Emily Taylor here with me tonight, but this is our entire team: Dr. Rebecca Chasson, Dr. Pam McMahon, Miss Linda Lee, and Miss Renee Davis, and it's our consensus that these are some things that you take seriously, and I think we've come up with some pretty good recommendations. The first one is to establish a plan of accountability for mental health services. I'm sorry, I'm on the next slide. A public awareness campaign should be developed to inform residents of the existence of the center services and the locations and times of those services. Establish a parish-wide work group to develop a strategic plan with measurable benchmarks for improving mental health services based on evolving needs and changing demographics. Develop a continuum of services for alcohol and substance abuse. Consider offering additional services, especially for children with behavioral needs, teen pregnancy, domestic violence, parenting, and anger management. Develop a partnership for establishing mental health services for youths and adults living on the West Bank and the East Bank of Ascension Parish, and offer staff additional training and certification in evidence-based modalities. According to Dr. Mittendorf's utilization data, the clinicians at the center are at an 80 to 90% utilization rate, so they're busy. Maybe offering them additional training that they can become experts in some of these programs that we're going to be discussing later would be beneficial to the parish to offer the clinicians that opportunity. Establish a plan of accountability for mental health services that engages stakeholders, consumers, and service providers. Providers should meet regularly to share knowledge and resources and to establish a mechanism for referrals across services when needed. And feedback should be shared directly and action plans agreed upon by all parties. And let me just put that in a nutshell. I was always told, and evidence does bear this out, when one person is satisfied with the service, one additional person hears about it. When one person is dissatisfied with the service, 10 people hear about it. And I'm strongly encouraging that all providers in the parish have dialogue with each other and communicate with each other to work it out. Because if you go back to 8 people who were dissatisfied with the center, we didn't ask if that was last month or 5 years ago. So there's no way to determine that. But there are 8 people who were dissatisfied who told at least 10 people, who might have told another 10 people. So that's a way of kind of going to the root of the problem and just dealing with it across provider levels. Seek local, regional, and federal funding resources to increase funding for services. Examine and amend policies that may hinder the provision of mental health services to children and adults in Ascension Parish. Consider development of community-based mental health services, and further explore those programs in Louisiana recognized as best practices. And we're going to go into those a little bit more, and I encourage you to maybe go visit those programs. And let me tell you a little bit about evidence-based practices and why that's so important. The National Alliance for the Mentally Ill, NAMI, has chosen 3 states that they want to work with to bring evidence-based practices, and Louisiana is one of those states. We have made them aware, and they have worked with us on this project. NAMI is very interested in working in Ascension Parish, working with the board, working with the executive director. They will provide the training in a lot of these programs and a lot of these practices. They will send therapists. They will provide technical assistance. So you have a wonderful opportunity to partner with a national leader in this. And evidence-based practices are integration of the best research out there and evidence with clinical expertise and client values. There are treatment interventions and services that have been proven to work with children and families. And these 4 modalities are basically the treatment method of how you would treat a child and or their family. And I'm encouraging you to look at maybe allowing clinicians to go to training where they become certified in these kinds of treatment methods, if they're not already. Some of the examples of evidence-based programs and the full description of these programs are on page 40 to 44 of your report. So I'm not going to go into describing them because I know we're short on time, but programs like Strengthening Families and Parenting Wisely, this is a program that's called GRAVE, Get Real About Violence, that's really well known and has been shown to be effective. Other programs are Keep a Clear Mind, Children in the Middle, which is working with children of divorce, Guiding Good Choices, and A Healthy Workplace. So those are just some examples, and again, the description of those programs are in your final report. Other models in Louisiana that have already been recognized by the federal government and that are not too far from you in proximity. And I'm going to describe a few things about those programs. The first one is the Better Access Community Health Program. This was started in Point Capee Parish, and what that parish did is exactly what you're doing now. In 2003, they did a community health assessment, mental health and health. And what they did is they wrote a grant and they developed a one-stop resource center that basically addressed all of the parish's needs. So for instance, they had no transportation to Baton Rouge and they have a very high cancer rate. They had a lot of elderly that did not have help buying prescriptions. They had very little mental health services in their parish. So what they did is created a resource center that you can go if you have questions about your Medicaid, your Medicare. You can go if you need help with your prescriptions. You can go if you're a diabetic. They have diabetic education classes. So they've really created a resource center based on what their community needs the most. It was recently awarded as a top 10 program in the country by the Johnson & Johnson Foundation. The Prosecutor's Early Intervention Program is another program. It's a program that was started by Phil Haney, who is the district attorney in the 16th Judicial District. And what he did is said, I don't want to see kids in court. I don't want to see them in my system. We're going to go to the root cause. And where do kids start to present with risk behaviors? That's in the schools. And so he developed a family service division that he puts case managers and social workers in every school. And the juvenile crime, the juvenile delinquency rate, the figures from that parish are astounding. That's another program. You don't necessarily need the prosecutor to be involved, but that's another program that's been recognized by the Justice Department, as well as the MacArthur Foundation. Project Fleur-de-Lis is a program that is based in New Orleans, and it's a program that started after Hurricane Katrina. The project is designed to help traumatized students via a step trauma pathway, and it includes services such as school-wide intervention programs, classroom-based intervention programs. Again, this is a program that's starting to receive a lot of national attention, and they have some really good data coming out of that program. The other one, this next one, is not necessarily a program that is recognized by the federal or state government, but it is recognized by the physicians in this parish. Every physician we talked to gave us this group as a resource. This is where they send their patients that need to be assessed and given treatment within 24 hours. They're on Jefferson Highway, and they offer assessment within 24 hours, often the same day. There were several physicians who say they call them and they send the patient in crisis directly to them. They are assessed, and it's apparently a very good working relationship. It's a model that you might want to go and visit. We took these models, and tried to adapt them to Ascension Parish. And let me give you a disclaimer here. This is just an idea, and this could be tweaked many different ways. But the first model is if you did take a one-stop resource center, and we gave you some examples of, maybe you have a 21-year-old mother who's depressed, a 2-year-old with a speech delay and failure to thrive, and your center is considered a resource center. You decrease the stigma of people going there because they go there for help. And, oh, by the way, you can receive counseling while you're there. So there are many services offered, one of them which is counseling. You could have one staff from the Ascension Parish Counseling Center there. You can refer the more intensive cases to Gonzales. But the idea is to give Donaldsonville something that they really need, and that's a little bit more concrete mental health services, not necessarily the intensive things that are offered in Gonzales. The next model is if you take the Fleur-de-Lis model and the prosecutor's early intervention model and maybe adapt it to look something like this. where the teacher refers an at-risk child to the principal. We have found that to be most beneficial, and I probably needed to say that we do work with a lot of these programs in other parts of the state, so we do a lot of their evaluation. The principal then determines what is the best route to go with the student, and he is the one, or she is the one, who makes the official referral to a case manager. The case manager is typically someone who does have some kind of social work, child protection kind of background, so has been in mental health and knows the system. They complete the assessment, they complete the evaluation of the child. The case manager and social worker have a conference and they develop the treatment plan. And one of three things might happen. The child might participate in an evidence-based program offered through the Gonzalez Center. They could receive family and individual counseling at the Ascension Parish Counseling and Substance Abuse Center, or a social worker can go to the school and provide treatment. Just whatever is in the best interest of the child. And then monthly case conferences to discuss that child. The other thing that you asked us to do was look for grants, and I'm happy to tell you that we found 7 grants that we think would be some potential funding sources for you, the board, and the director as you move forward. We would be more than willing to continue to research funding opportunities for you. We have had much success in writing those kinds of grants, and I strongly encourage you to do that, because a lot of the federal programs, a lot of the federal grant money does require your clinicians be evidence-based clinicians with those modalities. So it would all start to fit together. You would be doing the work you need to do to prepare, and then you would be eligible for a lot of federal funding. Now, in closing, I just want to say one thing. I'm so sorry for you that we were so short on time and I didn't get to tell my jokes. My husband would probably say, lucky you. I do want to thank you so very much for thinking of Robert Rose, for working with us over the last couple of months. We will be available. Our offices are 15 minutes away. We don't want to leave the parish or make you feel like you've been abandoned. You have a lot of data to absorb. You have a lot of information. The official report is over 60-something pages long. I encourage you to read that, and I encourage you to call us, ask questions. We're more than willing to clarify, answer questions, whatever you need to do. And again, thank you so much.
Thank you, Dawn. We appreciate all y'all work, and we truly appreciate it. Thank you, girls. We enjoy working with you and knowing you, and hope to see you down the road.
Okay.
Thank you. Would somebody like to make a motion to adjourn this meeting?
A motion that we adjourn?
Could I ask a question, please? Are we allowed to ask questions?
We got time.
What time is it?
We got time.
22. Yes, ma'am.
I can ask a question?
Yes, ma'am.
I appreciate that. I was looking at this, and what concerns me...
You can come to the microphone and introduce yourself, please.
The term the federal government and the state government is using today is behavioral health. And they are making an effort to separate substance abuse and mental health with primary diagnosis. And she did an excellent job of putting this together. But the problems you have is alcohol and drug abuse. But the survey was about mental health. Is that I'm going to have a question about that. There's two different things. Substance abuse is not mental health.
We understand that.
Okay.
And we have both problems in Ascension Parish. And
what is our needs assessment about drug abuse?
that there's a percentage in there about drug abuse.
Yeah.
And you'll have to give us a chance.
That is our problem in this parish, is substance abuse. We do have mental health, and just as serious, and it should be treated just as seriously as substance abuse. But we have resources available. They talked about training addiction counselors. There's a law right now that identifies addiction counselors. As far as a recommendation for best practices, there's JCO, CARF, and COA. They're the three accrediting bodies outside the state. Also, we have an accrediting body with the state of Louisiana.
Excuse me just a minute. Who are you? Please identify.
Sorry. My name is Joanne Brown, and I serve on the Governor's District 3 Healthcare Consortium. I'm a licensed addiction counselor. I own 2 facilities in the state of Louisiana. I treat right now approximately 50 people from Ascension Parish. Let me see, what else did I do?
Well,
I'm also on the regulatory board, and I'm also chairman of a state association that treats pain management treatment.
Okay, Ms. Brown, we will take your question under advisement, and we will get back with you.
Okay, that's just a question because
Yeah, I understand, and we appreciate it.
Yeah,
Thank
I'm
you
going
very
to a
much.
conference tomorrow in San Diego that SAMHSA is there, and we're discussing these very issues. Wesley Clark is a really good friend of mine, and we've done a lot of work with Wesley Clark.
And we will get a hold of you and appreciate your input into letting us know what is going on.
And another concern I have is a stakeholder that has that many patients coming to our facility, and we're state licensed on the web, but we weren't contacted. So
Well, I'm sure we missed some people, and we apologize for that.
But I've offered, this is about since 1980, I've been before this board several times about this issue, about substance abuse is kind of pushed under the corner, and we want to lump it with something else. And I think we're going to have to, in this state and every other state, you're going to have to take a look at one of your primary problems is substance abuse. And until we start looking at that in this parish, DWIs that don't get convicted, people that, all this is going on, and we have children dying, we have adults dying. You know, mental health, you have a hard place to put them if you need to refer them into treatment. But
that is what this needs assessment was to accomplish,
Okay.
and we think we have a good idea of where to go, and we appreciate your interest. Thank you.
Okay, and I would like to present you with a needs assessment from the federal government on alcohol and drug abuse. Maybe you'd like to look at that.
I would. Thank you
thank you.
very much. Appreciate it. Would somebody like to make a motion to adjourn?
Again, I motion that we adjourn.
Any objections? This meeting stands adjourned.